Hi guys, this is Dr. Gonzalez, and in this video I'm going to talk to you about the different components of experimental research methods. So for this particular week there will be two videos. This one's going to go over components of the research methods, and then the second video is going to talk about the particular methods themselves. And some of this information is a bit of an overlap because it's really important. I wouldn't mention it in multiple videos if it weren't important for you to consider. So let's get started. So let's talk about the specific components that are going to be found in different research methods for experiments. You've got to remember the goal of an experiment. The goal of any experiment is to establish and highlight that cause and effect relationship between two variables. So I've listed several examples here. The first one's positive feedback increases test performance. So I'm going to have several different levels of positive feedback, and I'm going to monitor test performance, and I'm going to see a direct increase. The next one is sleep hygiene increases sleep quality and duration. So I have a treatment condition where someone is getting some sort of intervention for sleep hygiene. Others aren't. And then I'm testing their quality and duration of sleep. The next one is more clinical in nature. I have CBT, which is cognitive behavioral therapy. I'm saying it reduces symptoms of anxiety and depression better than standard therapy. So my two conditions are CBT therapy and standard therapy. What am I testing? Anxiety and depression. The next one is reduced screen time before bed, increases sleep duration and quality. So I'm going to have different treatment groups. Each one of those groups is going to have a different reduced screen time condition. Maybe I say you can use it 2 hours before bed, you guys can use it 4 hours before bed, and then these guys in this third group can't use it at all after noon. And I'm going to measure their sleep duration and quality and see what the effect is. And then the last one is probably the easiest to understand within the context of experimental designs. This is a traditional sort of clinical trial. So I have it saying taking Somulex medication, which remember that's a made-up medication that I've used in several videos. Taking that medication increases your sleep quality and duration. So I'm going to have one condition that takes the medication, one condition that doesn't, but I'm going to measure the sleep quality and duration between all of them. So hopefully you can see that all of these examples have a couple of things in common. They all have a manipulated independent variable, and they all have a measured dependent variable. They also have different levels of that independent variable, and that's what we're going to be talking about in these two videos. Let's talk about the four basic elements of an experiment. So the first element I want to talk about is manipulation. We've already established the fact that an experiment needs an independent variable. That independent variable has to specifically be manipulated. That means you as the researcher are going to actively change one variable, and that manipulated variable is called the IV. So an example would be the following. Say you've got a researcher that wants to see how caffeine affects a person's sleep duration and quality. So they assign their participants to one of three different conditions. They can either get 0 milligrams, 100 milligrams, or 200 milligrams of caffeine. So caffeine dosage is going to be our manipulated independent variable. You should be listening in this video and thinking back to your research question and trying to identify how you, the researcher, are proposing to manipulate your independent variable. The second element that it's going to have is a measurement of the dependent variable. Remember, your dependent variable is the response variable, and it has to have a measurement tool associated to it. So that measurement is your dependent variable. Now, we want to see a direct change in that dependent variable that we can attribute to that manipulation of your independent variable. So I have a couple of examples down here. Positive feedback increases test performance. So my manipulation was the positive feedback, and I'm measuring it through test performance. With the sleep hygiene example, sleep hygiene is my independent variable. My dependent variables are sleep quality and duration. In the therapy example, I'm looking at symptoms of anxiety and depression. That's what I'm measuring. I'm not measuring CBT. I'm measuring how CBT affects the anxiety and depression. For the reduced screen time, I spoke about having 3 or 4 different conditions. One where you had no screen time afternoon, one where you could have it up to 4 hours before bed, and then one where you could have it up to 2 hours before bed. And that is going to be affecting the sleep duration and quality. So I'm going to measure sleep duration and quality, maybe using the PSYC. And then the last one is taking Somnulex. Increases the sleep quality. Sleep quality is going to be my dependent variable. Next, we have an element of comparison across our experimental conditions or our treatment conditions or our levels, depending on how you want to verbalize it. Any of those could be correct. So an experiment has comparison group or groups, okay? This just means that you've got a group that is going to not receive your treatment, and you're still going to measure their outcome variables. You're still going to measure their dependent variables. But what you can do is now draw comparisons. So if your groups differ on that dependent variable, on that outcome variable, and you controlled for all of the other possible explanations, this just means I've got high internal validity in my study, and I can attribute those changes to that independent variable. Now, you can achieve this by having one treatment group and a control, or you may have different treatment groups that give different levels of your intervention and then one control. It all depends on what kind of research question you're asking. And then the last element piggybacks off of that and is that control group. That control means you're going to control all of the other variables and prevent them from influencing your results. So that control and having that group is what allows you to argue that it really was your treatment, your independent variable, that causes a change in your dependent variable. You're excluding all the other outside factors. So what you're doing is saying the control group didn't get the treatment or the intervention, or in a clinical trial, it might be that they receive a placebo. So when you're dealing with clinical trials, most of these are medications, right? And so if I didn't give them a medication at all, it would be obvious to them that they are in the control. So what we usually do is give them a sugar pill or a pill that has nothing of the treatment in it, but they don't know that they're getting that. And all of that is usually explained in the IRB and the informed consent procedures. Let's talk about the key terms that you need to know and be familiar with in order to understand experiments. Some of these are going to look familiar to you because they were gone over in the first weeks of class. So you should be very familiar with independent and dependent variables. The independent is the manipulated variable, and it's going to be the presumed cause of any outcome in your dependent variable. Your dependent variable is measured. That's why it was so important in week 3 that we talked about those measures that you were going to use to collect data. Because without a good measurement tool, I don't really know if anything happened when I manipulated that independent variable. Another term you should be familiar with is treatment condition. So this is the specific situation or condition that you, the researcher, created. So say I'm looking at a study about sleep and concentration. One condition has 8 hours of sleep and another condition has 4 hours of sleep. So our treatment condition is the one that is getting the intervention. I'm studying concentration, but I'm going to take my participants and I'm going to assign them to a condition. They either go into the 8-hour group or the 4-hour group. Now I can make comparisons about the number of hours and how that directly has an effect on concentration. We also need to be aware of the concept of levels in your independent variable. There are situations where we want to explore what's called a dose response effect. And so what that means is something has an effect on another variable. And as you increase the dose of that something, you're going to see an increased response in your dependent variable. So an example of this might be the sleep drug that I have invented, Somulex, right? And I want to look at 10 milligrams and 20 milligrams, and I'm going to consider the group that is a control or receiving a placebo another level of that independent variable. It just happens to be 0. So those levels of independent variables are going to be specific values or categories of your IV. So some of you had a research question that had to do with positive feedback and negative feedback, I believe, or positive praise and negative criticism, something of that nature. So if I was working with children, little children, and they were completing some sort of puzzle task, and I wanted to look at positive praise, I might have a prompter that praises them every 5 minutes and a prompter that praises them every 25 minutes. So you see the different levels of that independent variable in that particular example. One of them is getting praised a whole lot more frequently than the other one. And then you might have a third group that gets no praise whatsoever. They're all being tested on the same dependent variable. They're all being tested on their puzzle solving ability. In an experiment, we generally have an experimental group or a control group, and that control group might also have another name. It might be a comparison group, okay? Because control and comparison kind of mean the same thing in some situations. So the bottom line is your experimental group is the group that's going to receive the treatment. You may have 2 experimental groups, one that receives a higher dosage of the treatment than group 2. But in all experiments, I need a control group because that's our comparison condition. If I don't have that control group there, I am not able to actually make a cause and effect decision. So let's talk about some more defining characteristics of experiments. The first one we've talked about already is manipulation. So if you took 4370 with me, which is non-experimental research methods and statistics, we focused on association claims. And we emphasized the fact that there was an independent variable, but that it was occurring in its natural state. That's because there was no manipulation. An experiment has to have manipulation. So you as a researcher have to actively create different conditions of that independent variable. So here's an example. If I wanted to compare sleep quality in people who report sleeping 8 hours a night versus people who report sleeping only 4 hours a night, this is not an experiment. Notice I use the word report, okay? All I'm doing there is drawing an association between sleeping normal, which is 8 hours, versus sleeping less and your sleep quality. Now, if I did an experiment and I divided my groups into someone who got 8 hours of sleep and someone who got 4 hours of sleep, right? So I let group of 8 hours, I let them sleep for 8 hours, and then I wake them up and ask them to fill out a sleep quality questionnaire. And I take the other group and I allow them to sleep 4 hours, and then I wake them up and give them the questionnaire. I've now drawn a conclusion that I could do an experiment with, right? I've assigned them to their hour of sleep conditions. So this is where a lot of people go wrong and misinterpret correlational studies or non-experimental designs with an experiment. So be very careful of that. You've got to have that element of manipulation. And there's some other characteristics that are going to go with it that are going to emphasize that manipulation. Control is another one. So a true experiment has a control group. And that control group exists to help us eliminate or reduce any effect that an outside extraneous variable might have, a confound. So remember, an extraneous variable is just any variable that is other than the independent variable that might be affecting your dependent variable. And they're problematic when they happen across treatment conditions, because what happens is they've now become confounds. Let me give you an example. If I have a researcher that's testing whether using background music affects your performance on a test, if I give the test in the morning to one group and another group takes it in the afternoon, I've now messed up my ability to draw a cause and effect relationship because I've introduced a new variable into the mix. I've introduced the time of day that I gave the test as an extraneous variable. So to fix that, what I would have to do is have one group come in, take the test in the morning using background music, and then on the next day, have a group come in and take the test without the background music, or I could do them on the same day in 2 different rooms with 2 different researchers leading the session. So we have to be careful of those, and the way we can be careful of those is by having that control group. The next thing that you need to be aware of in an experiment is the concept of random assignment. And keep in mind, this is different from random sampling. Sampling has to do with selecting your participants. Random assignment has to do once I have selected them. A true experiment is going to use random assignment. So it means your participants are coming into the research setting, and each participant has the same chance of being assigned to the treatment group or the control group. This helps strengthen your internal validity because it ensures that your groups are going to be equivalent before you do any manipulation of that independent variable. Because if your groups are the same at the beginning, any difference we see in our dependent variable is most likely due to that independent variable that you have manipulated. Now, how do we go about controlling extraneous variables? I'm sure you can see by this point that they could be an issue in experiments because you're not able to fully attribute the treatment effect to your manipulated variable. The first thing we do is we hold certain variables constant. For example, time of day would be an example of a variable that would be held constant in that previous example. Holding a variable constant means you keep it at the same level across all participants or all groups. So another one that you might need to be aware of in a test performance type research situation is the room temperature. If you have, maybe you've set up your experiment and you're going to run it concurrently on the same day in 2 different rooms, and you're going to have one group look at music or listen to music and take a test, and another group not listen to music and take a test. But one room is about 82 degrees because the AC is broken, and the other room is 62 because it's working super well. I can't be 100% sure that any treatment effect that I found is 100% contributable to that manipulated variable because I've introduced a new variable into the equation, and the variable is temperature. Okay, so even if I set it up at the same time to control for the effects of day of the time that I give it, I've now introduced another one. So you can't just say I'm going to control for time. You've got to think about all the possible variables that might be out there interfering in your study. Another thing we often do to control extraneous variables is matching. And matching means that the treatment conditions are equivalent on an extraneous variable. This would be an example of the time of day. Another example would be the one I have listed on the screen here. It says, if prior knowledge might affect scores, the researcher could match groups so that each condition has participants with similar pretest scores. Now, what that means is I give them a pretest and I place them into random groups based on those pretest scores. So you can see now, as we start introducing other things we have to control for, we end up getting a complicated research situation where you're worried about multiple variables at one time, and it becomes really difficult. That's why experiments are so well thought out and planned, and they go through IRB, and they aren't just things we decide to wake up and do tomorrow with a group of people. Randomization that we've already talked about, that's another way to help distribute extraneous variables across treatment conditions. So if I have those participants and I randomly assign them, by chance, I'm more likely to help create equivalent groups. And that has to happen before that manipulation happens. Let's talk about some things that are specific to control groups. So the control group, remember, is a group that does not receive the treatment, okay? We often call it a no treatment control group, but it's the same thing as saying a control group. It just means that you've got a baseline condition with no treatment, and you're seeing how that variable, your dependent variable, exists in the absence of a treatment. We often use a placebo if we're talking about medications. That's a fake or inactive version of that treatment. And we have to do that because in those clinical trials, like I told you, participants have an expectation. If I say I'm doing research on Somulex, a drug to help your sleep be better, higher quality, right? They have an expectation that their sleep will be better. And when you give them a pill in their hand, they have an inherent expectation that that pill is the medication that you are studying. So yes, it's a form of deception, but we talk about receiving placebos at the beginning of clinical trials. And in a good informed consent situation, a participant should know that they have the same probability of being assigned to the placebo group versus the active treatment group. Now, the placebo effect comes from using a placebo. And so what the placebo effect says is that by just believing that I'm getting in this treatment group, I may report better sleep, even though I didn't actually get the medication. And what happens is if we see a placebo control group exhibiting high levels of improvement that are approaching the same levels in the treatment group, something's going on. And you have to start questioning yourself then if your actual treatment group isn't just responding to a placebo effect. You'll see mentions of placebo group in medication announcements, commercials, stuff like that. If you read the fine print at the bottom of the screen, it'll often say 27% increase in better scores on this outcome versus placebo, and then it'll say like 13%. So it's important to pay attention to that when you're reading stuff about medications or other things of that nature. Now, we've already gone over validity. You've already done an assignment on validity. Let's talk a little bit more about validity in experimental situations. So one of the things that you were asked to write about in your previous assignment was the 4 different types of validity. And you should remember that internal validity specifically refers to that causal relationship. So the higher internal validity you have tells you that you can reasonably conclude that your independent variable was what caused the change in your dependent variable. So when do you have weak internal validity? Well, you have weak internal validity when there are other confounds that are out there that you have not truly controlled for. You cannot be 100% sure that your treatment effect was due to your treatment. It could be due to something else. So here's an example. We have a teaching method that is new. I want to explore that teaching method, but when I designed my research, I had one group that had an experienced instructor and another group that had a less experienced instructor. I've now introduced another confound, okay? I don't know if the improved outcome on a test is related to the instructor's knowledge and teaching practices, or if it's due to the new teaching methods. So the way we would remedy that is to make sure that our teachers in the different groups are teaching the same way. They have the same background knowledge about the topic that they're teaching at. They have the same years of experience. We want to make them as similar as we can so that we can absolutely know it was that teaching method that changed and that was different. You'll also remember that as you increase internal validity, you decrease your external validity and vice versa. There's a trade-off between the two. Because in order to control for all those extraneous variables, we actually create artificial conditions. So at the beginning of a previous video, I talked to you about the water maze and visual spatial learning in mice and rats. And I talked to you about how they have the Morris water maze and it's divided into 4 quadrants and there's a platform. And they put mice in the water, and mice don't like to be wet. So they are going to look for a way to get out of the water. And so they're trying to swim to a platform. And if I put visual cues on the wall, we find that these mice will learn how to get to that platform using those visual cues. And so I can teach them, and then I can test them on different things. So maybe I want to give them ginkgo biloba. And I want to see if that helps with spatial memory. That's great. But how am I going to translate that to the real world? Number one, I really don't. I mean, we have to do animal studies, yes, but we do research in general to better mankind, to make being a human better. And so I can see the point of giving ginkgo biloba to these mice and rats, because we want to see if this supplement that is sold out there and not regulated by the Food and Drug Administration actually works. And it's not always ethical to do that with humans. So we start with mice. But at the same time, those laboratory conditions are so super controlled, because I really want to be able to attribute that change in my dependent variable, how fast they get to that exit of the water maze, to the ginkgo biloba. If I try to translate that study to the real world, the external validity of those lab studies is extremely low when compared to their internal validity. So remember that a tightly controlled lab experiment, it can clearly show causality much easier than other studies because it has high internal validity. But it doesn't always translate to a real world application of that behavior or that treatment on a behavior. So let's talk about the strengths and weaknesses of experiments. So obviously experiments are great because we can come up with causal conclusions that we couldn't come up with in a correlational study. And that's due to the fact that we use a manipulated independent variable. We're clearly measuring our operationally defined dependent variable. We're looking at different conditions. We're controlling for those accidental extraneous variables. And we're doing those experiments because they provide the best basis for whether or not variable X causes variable Y. Experiments are also really good when we can isolate specific variables. And I just told you an example of that in the rats and mice in a water maze. There's not really an equitable human comparison to that. So it's useful in behavioral science. Behavior is complex, and when we can isolate it to specific variables, we're more likely to be able to say, hey, I've got a causal relationship going on here. There are drawbacks and limitations, though. Number one, even though experiments are the gold standard, it's not always possible to do them. Some variables simply cannot be manipulated. I cannot manipulate gender, okay? I can't manipulate things that have to do with trauma or poverty or abuse or serious illness. I can't give people cancer just to study how they react to having cancer with regard to depression and anxiety. I cannot, in all ethical judgment, assign people and actually give them cancer. As I said earlier, there are other traits like age or biological sex or personality traits that you can't manipulate. I cannot cause you to have a different personality trait in order to study it. I just can't do that. So even though experiments are the gold standard, just because they are the gold standard doesn't mean that non-experimental research methods do not have value. That's why we teach a course on non-experimental and one on experimental. And then, as we mentioned earlier, all experiments are going to be limited by that artificiality that you're imposing on them. So the more tightly you control that research setting, the less natural the responding behavior may be. I hope you enjoyed listening to that particular discussion about some of the background of experiments. I will be posting another video, which will go through the different kinds of methodology in just a moment. So make sure you've watched both of them before you go and tackle this week's assignment. Take care.